Caplyta, please. I appreciate the please, by the way. I'm not ChatGPT. You can't just like order me around. So this is what Caplyta looks like. And the generic name for Caplyta is lumateperone. So if I say Caplyta or lumateperone, it's the same thing. Now Caplyta is a really awesome medication. This is the binding profile. We've got the serotonin transporter, 5-HT2A, that's serotonin 2A receptor, alpha 1, alpha 2, D1, D2, and D4. Now it doesn't specify it on this chart, but the D2 activation is a partial agonist, kind of like Abilify, aripiprazole. And why a partial agonist is good is because if dopamine is too high, it gives it a ceiling, and if dopamine is too low, it brings it up. So it's kind of like a dopamine stabilizer at D2. And it's important to note that at D2 because D2 is like the site of action for schizophrenia. At least that's one of the proposed hypotheses. Now, most antipsychotics don't touch D1. And what ends up happening when it binds to the D1 receptors is that it activates a cascade pathway that essentially leads to antidepressant effects. Similarly to the way like ketamine works, because it activates the NMDA receptor. But it's a very indirect thing. It's not, ketamine is a direct one. This is an indirect way of doing it. But can we just take a look at what receptors this medication binds to? What are we missing here? We're missing histamine and muscarinic. And those sites of actions really cause the majority of side effects for people on second-generation antipsychotics. And Caplyta has been shown to have a pretty benign side effect profile. Now, Caplyta is only FDA approved for schizophrenia and bipolar disorder. But this medication is a powerful antidepressant, and it's a powerful mood stabilizer. So I ended up just doing some research, and looks like they're doing a clinical trial for Caplyta in borderline personality disorder and other mood disorders and schizotypal personality disorder. And this is a placebo-controlled trial, so placebo versus Caplyta. There are 60 participants, and they're still actively recruiting, so if you're in the University of Chicago, this would be pretty cool. Now, I'm a big fan of Caplyta because of how beautifully designed it is from a pharmacological perspective, but it is not generic, and it costs like $1,700 a month without insurance paying for it. And insurance will often give you a hard time if you want to pay for something that expensive. But the efficacy, the mood stabilization, the lack of side effects, and one really cool thing that has been noticed with Caplyta is that it causes pro-social behavior. A lot of times people with schizophrenia tend to be isolative, tend to have negative symptoms. Caplyta has actually been shown to improve interpersonal relationships, less isolation, more shopping, errands, cooking, walking, which is pretty much the goal of treatment, right? Giving someone their life back. So, big fan of Caplyta. Thank you for asking about it.